I'm Maria Batt, Director of Client Relations and Design at Shovel the Sidewalk, and we are a marketing firm in Buffalo focusing on building brands and connecting small businesses with their community through authentic storytelling. And today we have one of our clients on Sidewalk Talk, Dr. Kelly Truong from Crosspoint Dentistry. Welcome, Dr. Kelly.
Thank you, Maria.
So first, how are you? Are you healthy? Is your family healthy? You're clean?
All
Yeah.
good. Yes, we're getting into our new normal routine.
Yeah, new normal. So the ADA has obviously pushed out new instructions for you guys. So what have you had to do in your office to pivot and do what you need to do?
Sure. So the ADA is now recommending only essential care. So we have changed our schedule. We are no longer doing elective cleanings and preventative care. We're switching our focus over to those that really need us right now, especially with our limited supplies and the limited inventory that's globally available. So we really have to make sure that we prioritize so that we are available for true emergencies and true need.
That's something I think not everybody's thinking of is our supplies are finite, right? And if people aren't at work, they're not able to make these supplies. So you only have so much and you only have so much in terms of an ordering capacity.
Right.
So how,
Yes,
yeah.
exactly. So, we can place as many orders as we want, but unfortunately right now, we kind of get what we get. So we've hoarded our current inventory and we just have to make sure that we're prioritizing it for true need.
What constitutes a true need? If I'm sitting at home and I think, my tooth hurts a little bit, when should I call you and when should I maybe just take an ibuprofen and relax a little bit?
Well, our office, we've sent messages out to say that, we're here for you. So when do you contact us? When you need us. That's how it's always been. We have different ways of contacting us. If you call the office, even if you get the machine, it has our after hours number. So you just send us a text. So if you're in pain, you text right to me and I can advise you. During the week, we have someone answering our phones. So during the week is always a fine time to call. Monday through Thursday, we have someone at the office. So when you have a toothache, you give us a call and then we can manage it as best we can virtually, giving you advice. And if needed, you can be seen. But obviously, those are limited appointments right now.
And when your patients come in, they need to see you. What are you guys doing at the office to make sure that they're safe and you're clean and
Definitely. Well, the good news is dentists have been practicing universal precautions since the 90s. I mean, those of us who are old enough to remember our dentists when we were before universal precautions, you might not have had gloves, masks used. We can all remember those days. Those days are long gone. So our daily routine, things we've been practicing for 20 years at least, are wearing masks with our patients, wearing eye protection, and wearing gloves. So those are universal precautions. They protect us against many different diseases. Obviously, COVID-19 is a different animal as far as we know. And I think a lot of the problem is that we don't know everything. So we follow the CDC guidelines. We have masks and face shields. And we have a limited supply of N95 masks, again, for true need. So our office has always followed the infection control protocol and every surface is wiped. We use Birex, chlorhexidine spray. So, again, we've been practicing this for a long time. So the office is clean and it's safe in an emergency. It's safe for routine care, but obviously we're trying to be part of the global community to lessen the spread of this disease. So that's why we have chosen to eliminate our elective treatment and preventative care schedule right now.
I was thinking the other day, so much of your day, it's routine, starts with brushing your teeth, right? I know that I've been sick before and I look at the clock and it's like 2:30 in the afternoon. I'm like, oh crap, I haven't brushed my teeth like at all today. So how can people make sure that they're still trying to stick to a schedule, that they're keeping their dental hygiene, and what can they do?
It's funny. We have a lot of patients that came in this week, and they are getting into their work from home routine. And what they've learned from other people that have already been in that routine is that you have to have a routine. You have to have a schedule. It's easy to arrive at 3 p.m. in your day with your pajamas on, probably snacking all day. You may or may not have brushed your teeth, but the point is that you no longer have the routine that you used to have when you got up, showered, brushed your teeth, went to work, you had meals at a certain time. It's easy to get off track. So my advice to everybody is to do what we're doing with our homeschooling and with our work at home, where we kind of set a time that we're dressed, we're clean, we brush our teeth after breakfast, we brush our teeth before bed. We try not to snack in between meals because it really does take its toll on your teeth after a while. Hopefully, this is a short-term solution, but in the long run, it could really take its toll. And when we finally get back on track, you don't want to pay for it in cavities and fillings. So.
Yeah, eventually there's going to be normalcy, right? We're going to get, who knows what that new normal is going to look like, but we're going to get there.
That's
And
right.
you don't want to have all these bad habits that are set, because how hard is it to break a bad habit?
Yeah, definitely. Yeah. I mean, some of us already have bad habits and we've been trying to break them, but
They're adding on top of it.
otherwise, and when you don't have to walk out the door and see people, it's just that much easier to acquire new ones. So yeah, just like everything else, try to set a schedule, keep your teeth nice and clean, and then hopefully when you come back in, you come back in the way we last saw you, and not worse off.
This might be a crazy question, but people are going into Wegmans or going into Tops or wherever, and there's no toilet paper, there's no antibacterial hand gel, there's like nothing, and people are trying to get really creative with what they have. What happens if there's an issue and we can't get toothpaste or we can't get like dental floss? Is there anything that can get us through that?
These are great questions. I think first and foremost, you have an existing toothbrush. Toothbrushes should only be used for a few months at a time, but we can keep them clean. We can, you can actually boil your toothbrush. That gets rid of the bacteria. So you might be using that toothbrush for a while. Clean it up. You can also put it in an antiseptic. Put some Listerine in a cup and stick your toothbrush in there, because what it cleans off of your teeth, it cleans off of your toothbrush. Floss, I don't know. You'd have to get pretty creative with that. Maybe, like sewing thread or something. I haven't tried it. I don't know the research, but certainly it's better than nothing. And then, toothpaste. So the benefit of toothpaste is that it has fluoride in it. It doesn't actually clean your teeth any better than brushing without toothpaste. So while the fluoride is so important for protection, it's good to know that you are still cleaning your teeth, even if you're brushing and you ran out of toothpaste. So hopefully that can give some people peace of mind. And if you have a fluoride rinse at home, use that. That works really well too.
There's some fluoride in tap water, right?
There's definitely fluoride in tap water, so it's important to drink tap water. The good news is that if you're running out of bottled water at your local grocery store, just turn on your tap and it's right there and it's got fluoride in it.
Because you had said once that there are some people that think that there's more cavities now because of the people that are drinking more bottled water and they're not getting their fluoride.
There's definitely been a trend in the last 10 years where we have grown adults come in, they've never really had cavities before. All of a sudden they start to get a few, and every time they come in, they have a few more. And what we've learned is that it's not that they're eating sugar or not brushing well, but they have eliminated the fluoride from their diet just because they've switched to bottled water. So many of us have. So it wasn't something that we saw coming. It's something we've learned just out of change of routine.
Hmm. One thing that your office really excels at is working with people who have had a lifelong fear of the dentist, whether because they went there as a kid and they felt everything because the Novocaine didn't work, or they were just born not liking the dentist at all. And there's such a huge sense of unease and anxiety. Um, what do you usually say? What are things that you do with your patients that come in that are afraid of the dentist? What can help everybody just relax and breathe a little bit with all of this uncertainty?
One thing is that no one's going anywhere. We're all here. You can reach our office by phone. We can have virtual appointments. We had a patient call yesterday, incredibly upset because she was afraid she was going to be in her Invisalign aligners for months without getting new ones. I don't think I know that is not the reality. We can currently get takeout. You can come pick up your next set of aligners. I don't think that it's that dire. I think that we're just a phone call away. And while these are very unsettling and unnerving times, your dental health does not have to add to it. There is help there. I think it's also important that while the COVID-19 virus seems to be taking up a lot of resources at the emergency room and the urgent care centers, they don't want to see dental emergencies. So call your dentist. Your dentist is actually just kind of hanging around like everybody else, and you're not bothering them. That's why we are here. So dental emergencies should still be handled by the dentist. Part of our commitment and part of our responsibility, and part of in all of this COVID-19 environment, is to alleviate the burden on your GP and the urgent cares and the emergency rooms. So dental emergencies should still go to the dental office virtually and by phone.
Now, I don't have to worry about this because you're my dentist and I know exactly how to get in touch with you. But some people, their dentists have closed and they're not open at all. Some people, their dentists have such a limited schedule that they can't get in. If I wasn't seeing you and I had an emergency, could I reach out to Crosspoint?
You can. Monday through Thursday, we have someone here, managing phones. That would be the best time if you are not an existing patient already to give us a call. So Monday through Thursday, give our office a call, and we can certainly help guide you. Again, we're trying to get these virtual appointments up and going, so we can at least give you some guidance.
So what else? What's the one good piece of advice you can give everybody? Like your mom, you're stuck at home with your kids when you're not at the office trying to teach. You're definitely not a teacher. How can we keep it all together, Doc?
Definitely. We've got a lot of hats on right now, right? God bless our teachers, because it's one of those things we just let them handle, let them do. And unfortunately, we've been, tasked with a lot of it. I'm taking one day at a time, just like everybody is. And, I think it's important. How many times do we say to ourselves, I wish I had time. I wish I could get this done. I wish I could be with my family. I wish we didn't have any distractions. So if anything comes out of this, I think it's important to try to take advantage of what we have. We have no control over the rest of it. Staying home and being with our families, and trying to get those things in that we always say, if I had time, I would do this. Just make sure it includes brushing and flossing.
Perfect. Thank you so much for coming on. It's always lovely to talk to you. So if you would like to see some of our other podcasts, actually we have another one with Dr. Kelly. If you've fallen in love with her and want to hear a little bit more, you can check out our website, shovelthesidewalk.com. If you have somebody that you know, or it's yourself that has a story to share that you think can help all of us shut-ins right now, something that can help out a little bit, even if it's just giving us a little bit of a laugh, we have a form right on our Sidewalk Talk webpage. So fill it out and somebody will get back to you. We're obviously not going to come to your house. We'll do it virtually. And thank you guys so much for joining us. Thank you again, Dr. Kelly. And this has been Sidewalk Talk.